Hypocalcemia in dairy cattle, unveiling the challenges of calcium imbalance pathophysiology. Hypocalcemia, a condition characterized by low blood calcium levels, poses a significant threat to adult cows, as their normal calcium concentration ranges between 8.5 and 10 mg/dl. Meeting the calcium requirements during colostrum production, fetal maturation, and early lactation demands substantial mobilization of calcium from bone and an enhanced efficiency of gastrointestinal tract absorption. Intestinal absorption of calcium heavily relies on the production of 1,25-dihydroxyvitamin D3, triggered by parathormone, PTH, secretion in the kidneys. While increased renal absorption of calcium contributes minimally to calcium availability in transitioning adult cows, the action of PTH plays a crucial role in maintaining calcium homeostasis. When plasma calcium levels decrease, PTH secretion is activated, resulting in osteoclastic bone resorption, increased intestinal absorption facilitated by 1,25-dihydroxyvitamin D3, and enhanced renal tubular resorption of calcium. However, several factors can impede the efficient response to lactational demands despite appropriate PTH secretion. Acid-base status, particularly metabolic alkalosis, has emerged as a significant factor in milk fever and subclinical hypocalcemia. Alkalinization interferes with skeletal calcium resorption and intestinal absorption by altering the PTH receptor interaction at the tissue level. As a consequence, downstream signaling events that should lead to increased plasma calcium fail to occur despite PTH secretion. The paradigm of dietary acidification, supported by the use of anionic salt supplementation in dry cow diets, has proven effective in reducing the incidence of milk fever and subclinical hypocalcemia by inducing relative acidification in late gestation. Additionally, age, breed, and endocrinologic factors, such as estrogen levels, can contribute to the development of hypocalcemia in dairy cattle. Clinical signs. Parturient hypocalcemia, commonly known as milk fever, typically manifests within 24 hours before to 72 hours after calving. The initial signs are restlessness, excitability, and anorexia. A notable behavior observed in affected cows is the protrusion of the tongue when stimulated around the head, a displacement activity usually seen when cows experience conflicting emotions of aggression and fear. The cow's ability to regulate core temperature becomes gradually compromised, resulting in high or low rectal temperatures depending on the ambient temperature. Cutaneous circulation is depressed, leading to cool extremities in colder conditions. Rumen contractions weaken and may eventually cease. Skeletal muscle weakness progressively develops, causing cows to stagger, fall, or become recumbent. During the hypocalcemic state, heart rate increases, but cardiac output decreases due to reduced venous return and weakened cardiac muscle. Bloat occurs as a consequence of failed eructation. Without timely intervention, death may occur within 12 hours of the onset of signs, often caused by suffocation due to bloat or cardiovascular collapse. Traditionally, hypocalcemia has been classified into 3 stages, with stage 1 characterized by the cow's ability to stand, stage 2 by recumbency, and stage 3 by coma and unresponsiveness. Treatment. The most widely used treatment for hypocalcemia is the parenteral administration of calcium borogluconate. The selection of calcium concentration, calcium salt formulations, and additional components within the infusion solution can vary based on personal preference and individual cow requirements. Calcium borogluconate solutions administered intravenously or subcutaneously result in rapid recovery of skeletal muscle tone and restoration of smooth muscle function in the gastrointestinal tract. During the administration of intravenous calcium, cows often eructate, defecate, or urinate, and many uncomplicated cases of stage 2 hypocalcemia regain the ability to stand before or shortly after the infusion is completed. In cases where cows are recumbent on slippery surfaces, it is crucial to carefully move or slide them to prevent exertional myopathy and other musculoskeletal injuries. The normal serum calcium concentration in cows typically ranges between 8.5 and 10 mg/dl. At a calcium level of 7 mg/dl, cows can usually stand but may experience moderate bloat and anorexia. Most cows become recumbent at a calcium level of 5 mg/dl, while levels below 4 mg/dl often result in a comatose state. A standard 500 ml bottle of 23% calcium borogluconate contains 10 g of calcium. For a mature Holstein cow weighing 700 kilograms and in good condition, with approximately 210 liters of extracellular fluid, a calcium deficit of 10.5 g would necessitate the administration of one standard bottle of calcium to raise serum calcium to 10 mg/dl. Additional calcium supplementation may be considered to compensate for anticipated ongoing losses. It is noteworthy that the heart rate typically decreases to some extent during the infusion of intravenous calcium solutions to hypocalcemic cows. If an abrupt increase in heart rate or arrhythmia occurs during the infusion, it may be necessary to slow or discontinue the infusion. For successful intravenous administration, calcium solutions should be warmed to body temperature before use. Solely subcutaneous treatment is inadequate for recumbent cows due to impaired circulation and slow absorption. The availability and utilization of oral gels and liquids have increased among producers for the treatment and prevention of hypocalcemia. Among the simple calcium salts, only calcium chloride has demonstrated adequate bioavailability for the therapy of clinical milk fever. However, caution must be exercised when using liquid forms of calcium chloride as a drench, as they can be highly caustic and have caused aspiration pneumonia and death in cows. The use of oral calcium supplements requires functional swallowing reflexes to prevent the entry of caustic materials into the trachea. Therefore, the severity of hypocalcemia and muscle weakness should be assessed in each individual before considering oral calcium supplementation. Calcium propionate, incorporated into drench mixtures, has gained popularity for early lactation cows that are off-feed. Administering 1.5 pounds of calcium propionate orally provides approximately 140 g of calcium, while 1 pound provides around 90 g of calcium. Calcium propionate offers the added advantage of serving as an energy source, propionate source, without the caustic properties associated with other calcium salts. Evidence-based research has shown favorable relapse rates and clinical response to oral calcium administration compared to conventional intravenous therapy. However, the decision to administer intravenous calcium therapy for recumbent milk fever cases remains at the discretion of the clinician and may vary depending on farm practices. Nevertheless, on many dairy farms, the administration of calcium to anorectic cows with mild hypocalcemia has transitioned entirely to the oral route. In the majority of uncomplicated milk fever cases, a single treatment is usually sufficient. In the event of a relapse, consideration should be given to supplementing magnesium in addition to calcium. Magnesium hydroxide rumen. Laxative boluses or magnesium oxide can be administered orally for a few days after parturition to provide supplemental magnesium. However, excessive use should be avoided to prevent systemic alkalosis and decrease in ionized calcium levels. Practitioners may differ in their recommendations regarding complete milk removal from mature cows at risk of milk fever. While partial milk removal may help reduce the development of hypocalcemia, it should be noted that cows not fully milked out may experience milk leakage and an increased susceptibility to environmental mastitis. Hypocalcemia demands timely attention and appropriate treatment to prevent severe complications and improve the welfare of cows during the critical transition period. Early detection, proper management, and veterinary intervention are paramount in effectively addressing this silent adversary of calcium balance in dairy cattle. Prevention and control. Preventing hypocalcemia is crucial for maintaining herd health and productivity. Several preventive measures can be implemented. Proper nutrition management during the dry period and transition period is essential to optimize calcium and other mineral levels. Ensuring a balanced diet with appropriate calcium to phosphorus ratios, along with adequate magnesium intake, can reduce the risk of hypocalcemia. Supplementation with anionic salts in the late dry period helps maintain a slightly acidic urine pH, promoting calcium mobilization and absorption. Furthermore, maintaining good cow comfort, minimizing stress, and providing a well-managed environment contribute to overall cow health and reduce the incidence of hypocalcemia. Regular monitoring of blood calcium levels and working closely with a veterinarian help identify high-risk cows and adjust management practices accordingly. By focusing on prevention and control strategies, dairy farmers can minimize the impact of hypocalcemia on cow health and productivity.